Okay, so this case study is really a small data problem, but I think it has a lot of implications for big data. And since we're all starting to get a little hungry, maybe I'll frame this by asking you all, as I talk about our journey, to think about where big data could help now and in the future. So maybe we'll frame it that way. Oops. So under a value-based care contract, should we be paid the same to take care of each of these patients? And let's, for the purposes of this case, define value-based contract as either an upfront payment for the care of the patients or some sort of budget where your healthcare expenses are, put against. So I think most of us would say, yeah, sure, give me a lot of that young guy with the yoga pose, and maybe not so many of the older woman who looks like she's already using a walker, so there's probably a lot going on. But what if your population actually contained more of the older woman and less of the younger guy? Would this be fair? And would anybody then want to do a value-based contract if that's the scenario? Right? I think most of us would think, no, this is not fair. So that's the idea of risk adjustment. It's the idea that your demographics, age, sex, zip code sometimes is a marker of socioeconomic status, and your population's underlying health conditions, then through an algorithm, adjusts the payment that you get in a value-based contract. I mean, it's an effort to level the playing field so that it's fair across different organizations and different populations.